Good afternoon and welcome to the Great Lakes Health Program. I'm your host, Francesca Messiah from Kaleida Health. At Kaleida, we see people, not just patients. Well, our topic for today on the Great Lakes Health Program, we're going to be talking about cancer survivor steps. Many people survive cancer, and one thing you don't hear about as much is what happens after survival. What happens? Many times the families have questions, the individual has questions, that close friend has questions, and that's why for today our guest is Donna Gefaller. Donna Gefaller. Donna is a registered nurse and coordinator of cancer programs. Good afternoon, Donna. How are you?
Good afternoon. I'm good. Thank you for having me.
Oh, good. I'm so glad. And this is not Donna's first time, but probably in about a year. And the program has changed, and that's what we're going to talk about today. So Donna, could you just tell us, just starting with, can you tell us a little bit about the Cancer Survivor Center at Kaleida Health?
Sure. First of all, just like you said, Francesca, I am the coordinator of cancer programs, and I'm also a certified breast care nurse. And survivorship, no matter what type of cancer you have, is such an important part of your, ongoing, like we just said, survivorship. Mm-hmm. So, actually people are a little, they're not understanding so much of what is survivorship. It actually starts, if you look at the diagnosis, it starts at the time, or the definition, it starts at the time of diagnosis. So, and then till you're done with treatment. So, it's just such important part of cancer care, and I can help patients navigate, which is a very difficult time in their lives.
Well, and it seems like having a cancer diagnosis would be a very difficult time for individuals. And could you just talk a little about that?
It certainly is. I mean, first of all, there's the shock of, getting a diagnosis and, coming to grips with all that. And then there's the multitude of procedures and tests, possibly surgery, the cancer treatments, such as chemotherapy, radiation. It can be a very overwhelming time. And, with the increase of oncology care being offered at Millard Fillmore Suburban, giving the patients the support and resources that they require is very important.
And if you could just go into where is Millard Fillmore Suburban?
It's in Williamsville on Maple Road, and that's pretty conveniently located. I think people think it's pretty far away, but it only took me 20 minutes to get here to downtown Buffalo.
Well, thank you, because I'm not going to assume that all of our listeners know where Millard Fillmore Suburban is. It's been in our community for, at least 20 years or so.
I think even 30, yeah.
30, and it's like about 20 minutes from the studio here at WUFO. Mm-hmm. So just to give people a visual in terms of where it's located if they have to see you. Can you tell our listeners about what do you do, what types of support for the patients, and is it for the patients or is this for the patients and their family?
Primarily for the patients, but of course, so often people don't come to the hospital by themselves, mm-hmm. and, they usually have a support person. And so, really what I do is for all involved. And important part of what I do is helping patients through education. I do run a breast cancer surgery class at Millard Suburban twice weekly. And we cover everything for what to expect with surgery as well as the recovery. We also review community breast cancer resources that are available. It's related to the emotional support of things, the dietary, and then the physical side of recovery. We do a lot of breast surgeries at Millard Suburban, and upwards over 1,000 per year. So, it's very important that to support that population as well as the other cancer populations that come to us.
Now, something you mentioned, you said that twice a week you have these classes?
Mm-hmm. Yes.
And are the classes only for those who have been diagnosed or gone through cancer surgery or something? Or I'm just thinking we have a lot of listeners, and I didn't know if a student that might be interested in this topic or if someone who's just interested is able to sit in on the classes.
Oh, certainly. Anybody that was interested, I would be more than happy to share information with.
Oh, well, that's great, because I always, this is also an educational program.
Sure.
So that's great. So how do you then connect with the patients at the hospital?
Well, when people come in for medical procedures, surgery, or even for chemotherapy, I can meet with them and address their needs. Sometimes they may need to be linked with a counselor for emotional needs.
A counselor at the hospital?
Well, we have counselors that we've partnered with in the community. Mm-hmm. Sometimes individuals may be experiencing physical impairments, and that's where the Survivor Steps Cancer Rehab and Recovery Program comes in.
And just going back to something you talked about, linking with a counselor, is it something that sometimes patients, if they have, they're limited with transportation, can they also call that counselor sometimes?
I think that's always an option,
mm-hmm.
just to get that little support. Plus, there's so many other support groups. There's, all kinds of avenues for individuals to get extra support. There's even phone support where you can be linked up with a cancer buddy. And people aren't aware of what's available to them. And that's why I'm just so pleased that Kaleida supports cancer survivorship, because people don't realize everything that's available. You don't find out you get a cancer diagnosis and somebody shows up at your doorstep saying, oh, let me help you figure out this whole system. You really need someone that, you can turn to and rely on.
Like you, Donna.
That's me.
That's right.
That's what I do.
And in case you're just joining us, I just want to say before we get to the next question, today our topic on the Great Lakes Health radio program, we're talking about cancer survivor steps with Donna. Donna, is cancer rehab something new?
No, it's not. Actually, it's if you want to think about rehab, it's so typical after a knee replacement or a stroke, but we don't think about it for, the cancer patient, and it's so important. So, relatively speaking, I don't think that it's been, public knowledge that, cancer rehab is, as prevalent as those other type of rehabs that I mentioned, but it's been available for years. So it's for patients who are going through cancer treatments or who have completed their treatments. And this program it's pretty unique because it can help those through their battle with cancer from the time of diagnosis until remission. So it really does go hand in hand with that whole survivorship model that we had mentioned earlier. Survivor Steps cancer rehab includes physical therapists, occupational therapists, speech therapists, and these therapists have all been cancer rehab certified. So they're specialized with us at Kaleida Health.
How about a nutritionist? Is a nutritionist also part of that?
Yes. If somebody's interested in, the dietary, nutrition side of things, I can link them with someone who's wonderful.
Only because I remember one time speaking with a cancer survivor, and they said their taste buds weren't the same.
Absolutely.
So I just remember that, someone saying that they didn't have the same taste buds.
And how important it is.
Yes.
Because you need those nutrients to heal and recover. Mm-hmm. So meeting with somebody who can help you.
How can if it's a family member or if it's the survivor who's listening to you, how can they contact you?
Well, I would like them to call me, so
okay.
I can share my number. It's area code 716, and that's 568-3511.
And could you say that one more time, please?
Sure. 568-3511.
And I know I talk a lot about the app in the earlier part of the program. Is your department also on the Kaleida website?
It is.
Oh, okay.
It is.
And what would they...
There's actually a tab that's I gotta think. It's labeled. I'm not sure if it's oncology rehab, but it's like the oncology service line. So it's pretty easy to navigate.
Oh, wonderful! Oh, great. Can you explain a little more about the needs of someone with a cancer diagnosis? What that some more? Could you give a little more detail?
Absolutely. Sometimes the need may be to learn more about the cancer itself. I meet people all the time that they're confused about even their diagnosis. And perhaps maybe when they got that diagnosis, they might have tuned it out and only captured a fragment of what their physician was telling them. And it can be a really confusing time. And sometimes it's understanding a test or a procedure. Why am I having this done? What exactly, does it mean? Where do we go from here? And then there's the emotional side of things, which can be very complex because people are going through so much from, the financial side of things to, how to talk to their family. And that's why it's so important to have the mental health specialists and the counselors and these support programs that we can refer patients to. Then other times it can be the physical part of recovery as well.
And also during the appointments and the visits with you and other therapists, listeners can bring their family members with them to help them,
definitely,
to hold their hand for that.
It's so important to have an advocate. And one of the things that I feel is important too is for people to advocate for themselves, because I think sometimes it's intimidating when you don't understand and somebody is saying, big words and big terms to you, and it's scary. And sometimes it's okay just to say, could you explain that a little bit more thoroughly?
I don't understand. Could you please? Yeah,
sure.
Exactly.
And then to have someone there with you taking notes and, really that extra set of eyes and ears, paying attention so that, all that information is gathered. But if it's not, I can help with that.
Oh, good.
Too.
What do the physical problems look like?
Okay, so the most common symptoms include weakness and pain, and fatigue as well. But then there's issues with balance, and that's horrible. If people are trying to be independent and could potentially be falling. People really want to stay independent. Then there's issues like swallowing and speech problems, and sometimes even lymphedema, which is, horrible to have to deal with. It's the swelling of, like, the extremities, like the arms and legs, and we're very fortunate because we do have 3 lymphedema certified therapists at Kaleida Health with us at our outpatient rehab location. So we're very fortunate to have that. We're so lucky to have these qualified cancer rehab therapists, and really, it's like easy to talk about and say, oh yeah, we've got these cancer rehab therapists, and it's such a special thing, but it really truly is, because there are no other programs out there in Western New York. They have the specialty rehab therapists that we do at Kaleida, so it's really amazing. And we've had so many great success stories from people who have had experience after the side effects from their chemo and their radiation. So it's just wonderful to help people recover more completely.
Now, balance. I've never heard about balance. So why would balance? How is it having cancer surgery, and how does that affect your balance?
Well, sometimes it's the weakness or the fatigue. Weakness. And other times it can be what's called neuropathy, which is like that pins and needles in the hands or feet, and particularly if it's in the feet. People don't know, they can't feel when they're taking the step, and that's when they could potentially fall. So the therapy group, the physical therapists, the occupational therapists, they know how to work with people to teach them, to train that brain so that they know when that step is coming. And so, there's no falls, which is really important.
I know we touched on it a little bit before, but we talked about nutrition, and could you just go into a little more depth on that?
Yes, we're really fortunate to have our registered dietitian who sees patients that can come outpatient. That's pretty unique in a hospital setting, that we have someone like that. And she will meet with the individual and explore their dietary needs and help put together that healthy eating plan. And like you said, Francesca, sometimes people, there's just things that they can't eat, and they've lost a taste for certain things, even sometimes, their favorite foods, which can be distressing. So we help them work around that.
That's great. And And I know that I've never heard. What is it? You something else that you do for patients is a survivorship plan. Mm-hmm. So, and that makes me think of a planner, like a plan. Like, is there a sheet? Is there something that, like a spreadsheet, or is there like a checkout? Like what does that?
It can be. A survivorship care plan can be, just like you said, it can be like in a written format. Right now, it's a little bit more loose what we're doing, but I can see it going in that direction because we are having so many more oncology services at
with
Kaleida.
Survivors.
Absolutely.
Yes.
And, patients are very, very savvy, and they want to feel their best and have great outcomes from their cancer treatments. And survivorship is a very important thing in the cancer community. So, this is something we're going to be hearing more and more about because, people are surviving these cancer diagnoses and they want to feel well. So I'm just so glad that Kaleida Health is vested in providing the best care for people going through such a difficult time in their lives.
Mm-hmm. So tell me a little bit more about one of your success stories. Someone who's been through, someone who, let's say, who was scared, not sure, and tell me one of the stories of someone who has personally gone through the program.
When I think of somebody, the first person that comes to my mind, it was interesting because she came to us and we had just mentioned the falling and problems with balance. And so she came to us not even knowing that we had a specialty survivorship program. And she happened to see the sign as she walked in our doors in our Maple Road location. That's where our one outpatient rehab location is. And she said, "Oh my goodness, I had no idea there was such a thing." Mm-hmm. And this is a woman that was actually a triathlon. So, she was doing the swimming and the running and, every component that you can imagine. When she came to see us, was wheelchair bound. And she emotionally was a wreck. And so our therapy team, did a very thorough evaluation. And, through everything that we discovered, she was having, emotional issues. So we were able to connect her with our we have a really lovely program for individuals that can come to it's a really great support program. Mm-hmm. And then there's the other side of it. She needed to work with a cancer counselor and then the dietitian. And then we were able to work with her so thoroughly through the rehab that we were able to help her learn how to walk again. Oh. So, I mean, you want to talk about the best outcomes possible. So it was absolutely wonderful.
And I know that we have a language and a translation service. So I'm thinking that if someone is having cancer, is having a surgery, that in case they don't speak English or English is not their primary language, that we can use the phone system that we have.
Definitely, yeah. We would always turn to that if there was any language barriers. So that's a very important part of what we do. Mm-hmm. It's very necessary.
Donna, now how does someone, if someone's having a breast cancer procedure at the hospital, do you meet them before they have it? Do you meet them after? How do patients meet you?
Well, my hope is,
how do they meet you?
And I do work with the surgeons, that they find out about me ahead of time and that they come to my class. And so we start our relationship that way. If for some reason they can't come to the class, I make sure that I meet with them before surgery.
Can a family member come to the class in their place, or does it have to be the individual?
I think it's always best if it is the individual for privacy reasons. But, if we get the okay, from the patient, we can work around things too. And I send information in the mail, and I do lots of phone calls and anything that's necessary to get the information there. There's a way to work around it.
Now, you had mentioned the class before. When is the class again?
On Tuesdays and Wednesdays from noon until 1:30.
Are there any evening classes, like after 4 or 5?
Right now we don't have evening classes, but like I said, I've met patients in pre-op testing like all the time. I do that. I send information because we do have, people coming from far out or they don't have transportation. And so I'll mail them our class information and then we'll just talk through things over the phone. I have no problem with that.
So pre-op testing, that's where they come and get the blood work and things
before surgery they have
Okay.
to go through, the EKG and the blood work and the X-ray and all that kind of stuff. So, I'll go down there and meet with them. And
so your schedule is flexible. So it sounds like you've probably met with patients at 7 o'clock in the morning.
Oh, sure.
Okay,
Yeah,
so you're
sure. I do what I
you're
need
there
to
to
do.
meet the patient.
Yes, I absolutely am.
Well, I know I have a few other questions, but is there anything you want to touch on before we close? Anything else you want to cover or stress?
I think it's important for the community to know about what we're doing with oncology services at Kaleida Health. We now are doing chemotherapy and, providing that side of treatment, but there's also the testing and procedures and then the surgical side of it as well. So I don't know if Kaleida has traditionally been thought of, in the oncology world, and that's changing. And it's exciting to be able to care for our community in that capacity because there's a lot of suffering out there. And, Kaleida really has embraced, putting together a great model for our patients so that they can get the best care and the best outcomes possible. And then there's the survivorship side of things, helping, people from the very beginning, no matter what services they need, to know that there's people like me,
Right.
That they can turn to and help them navigate their way through, the system, which is complicated and confusing and overwhelming and, even like the financial side of things, when bills start coming in and understanding that and who do I talk to and who do I call?
They can come to you? They can come to you?
You can give me a call and I will direct them in the
Okay.
right place. I mean, I have resources that can help people about grants and, things that are available to them. Our charity care at the hospital. How do I get a hold of those folks, So, if people call me, I can help them with those things. And it's necessary for people to understand.
And if you could give your phone number one more time.
I sure can. So it's it's area code 716, and it's 568-3511.
Well, Donna, thank you so much. You've been a wealth of information for the hospital, for our community. I just want to thank you for being with us this afternoon.
Oh, thank you, Francesca.
Yeah,
So
thank
it's
you.
my pleasure.
Oh, thank you. And now we have our announcements. Where is Kaleida in the community? And again, as I said, if you go to the Kaleida Health website and click on Community Health, there is a calendar. The calendar will have information such as Donna's classes. It'll have information on what I'm about to share with you right now. We'll be speaking at East High School. I have someone coming in. I've made arrangements for someone to come and speak with the high school students. So again, I always say that that's one of the things that Community Health does. We arrange speakers. This week we'll be at the Lovejoy School, part of the Parents' Evening. They're having several vendors, and please look for the Kaleida Health table. The day before Easter, the Matt Urban Center is having a Matt Urban Center is having a children's health fair, and we will have people there from our children's health home, the Oshai Healthy Children's Home, and also we'll be at the Buffalo and Erie County Public Library. Again, check our website, and tomorrow we'll be at a program at the art gallery. So please stop by and visit with the Kaleida table. Again, always call 859-8045, 859-8045. Next week, the voice you will hear will be Kelly Showard from ECMC, and in 2 weeks, I will be back with you. I am Francesca Messiah from Kaleida Health, where we see people, not just patients. Bye-bye.